Hey, Adrienne here with Moving Forward with Diabetes Management. So, one question I'm often asked is I have prediabetes. What now? What now? Like, I have this diagnosis. What am I supposed to do? Like, is this the end? Is it over for me now? I just don't know. I just don't know what to do next. So, my first response is no, this is not the end. It may feel like it's the end, but it's not. As a registered nurse and also as a certified diabetes care and education specialist, I've seen thousands of patients. Thousands of patients. I've been a registered nurse for over 20 years. So I will say that once you receive the prediabetes diagnosis, yes, initially it can be a shock. It can be something that is like, what do I do next? What am I supposed to do with this diagnosis? Do I have to stop eating everything that I love? Do I have to stop doing what I love to do as far as my eating habits and going out to eat with my family and friends? So let's talk about it. Let's sit here and talk about it, okay? Three tips. Three tips. So, first, I would like to say that when you receive the diagnosis of prediabetes, it's not the end. It's not the end. To me, it's more of a warning, more of a caution sign, more of if we're at a traffic light approaching it, okay, we've missed the green light, so now it's yellow. So the caution is, what can you do to make the necessary changes to be healthier? Okay? To be healthier. Because at the end of the day, that's what it's really about. It's about a healthy lifestyle choice, healthy lifestyle changes, and being consistent in that journey. So number one is, let's realize that it's caution. It's not the end, but it's some things that we have to change. Okay? Number two, let's think about being consistent. Yeah, being consistent. So I know it's easier said than done. I know. I know it's easier said than done. But being consistent plays a huge role. It plays a huge role in your diabetes management. So, okay, the diagnosis of prediabetes has been given. Okay? Caution. We're not at green. We're not at red, but we're at caution. So these are our warning signs. Two, we have to be consistent. We just have to be. We have to be consistent with lifestyle changes, lifestyle choices, behavioral change. And I will say, of course, I get it. We're human, right? We're human. This is not going to happen overnight. Okay? It's not going to happen overnight. Be okay with that. Be okay with that. Be okay knowing that this is not going to happen overnight, but the changes that we put into place will help us over the long term. They're going to help us over the long term. So, when we're consistent, we're going to see the results. Okay? So, I always like to tell people, this is not a sprint. If you're familiar with track and field, this is not the 100. This is not the 200. The 400 is more like it. Like you're doing the 400, but you still have more laps that we have to complete. More times around the track that we have to complete. So don't give up. It's not going to be a quick sprint. It's going to be more like we got to go around the track a few more times. But you can do it. You can. So many other people before you have. So many people now are doing it. And so many people are in the place where they're getting ready to start. They're at the starting line. Okay? So don't give up. Don't give in. Be consistent. This is a journey and you can and you will complete it. Consistency is key. Number three, accountability. So, this is not an end-all be-all diagnosis. This is actually a diagnosis that shows us that with consistency, with accountability, you're going to be just fine. You're going to be fine to move to the next level. You're going to be fine to understand that behavior change, lifestyle change, it is possible. You can make those tough choices. It may mean the difference between drinking water versus drinking a sugary beverage. But the choice is all up to you, and to be accountable. Be accountable for your decisions. And looking long term, the ultimate goal is to either prevent type 2 diabetes or to slow the progression of type 2 diabetes. So when we look at the big picture, yes, it's a very important diagnosis for us to be aware of. Yes, we have to be consistent. And yes, we have to be accountable. But long term, we're looking at our overall health, your overall lifestyle change, your overall lifestyle choices. So you can do this, okay? You can. Don't give up. Don't give in. Just know that you can complete this task. And guess what? At Moving Forward with Diabetes Management, we offer Take Charge and Balance. And you may say, what is Take Charge and Balance? It's really what we just talked about. It's accountability. It's our 12-week program where you work with me as your coach, as your cheerleader, as your motivator to get to those goals that you're working on, to setting those goals, to making the progress on those goals. It's 12 weeks of knowledge, 12 weeks of learning, 12 weeks of engagement, 12 weeks to set you up for tremendous success, for tremendous healthcare goals, to set you up for, oh yeah, I can do this, I can, believing in yourself, knowing that you can do it, knowing that accountability, consistency, all of that works. All of that makes a huge difference. It makes a huge difference. And guess what? You can do it. Take Charge and Balance. The information's in our links. We also have ebooks that talk about activity and movement, snack solutions. All that information is in our link. I'm so excited. I'm so excited for you. I'm so excited that you took the time to learn more about prediabetes, to learn about all of the information that we have in our videos, on our channel. Like, comment, subscribe, tell your family, tell your friends. And guess what? Even if you don't have the prediabetes diagnosis, having prediabetes diagnosis and the education and information can help anybody. Even if they don't have the diagnosis, it can help anybody to have a healthier lifestyle, because it's about lifestyle changes, behavior change, and just knowing that we can make these changes, that you can. So again, Take Charge and Balance is our 12-week program. Click the information, click the links to get more information, and like, comment, subscribe. Share this with your family and friends. Happy, healthier lifestyles. Until next time, I'll talk to you soon. Bye, guys.